the heart sank. 17-year-old boy. And seeing the CT scan, obviously with so many years of experience, we know what the outcome is going to be. And even if we thought that if he makes through the next 24, 48 hours, he's not going to have a quality of life. Car accident in which the husband and wife were sitting ahead and the child was behind. And another thing, coming to this story, we do not use child seat.
Yes.
We do not use seat belts in the back seats. Worst thing that can
That's
happen.
a sad state of
That's
India.
the sad state, and this has happened. Husband, wife, both were injured, but were alive. Child died. Unfortunately, probably I have not come across any organization or any biking community which actually focuses on the medical emergency. Now, given today's era, people are getting heart attacks even in their 20s. Now, fine. Obviously, a biker cannot be expected to treat a heart attack. But at least if he's aware that, okay, these are signs and symptoms, probably this is what needs to be done if something like this happens, that can itself prevent a lot of things. Fast roads where we can drive at 120 kilometers an hour, given the example of many expressways for that matter.
Yeah.
So what happens is, in such situations, the trauma can happen. It's not completely in my hands. 50%, if I'm careful, I'm safe, but the rest of the 50% is always a chance. So accidents are accidents, they're never planned. There are a few questions that we ask to understand whether there's a head injury or not. First, did they lose consciousness at the site? We keep on insisting who has seen you first, because this person might not remember. That is called amnesia. Basically, they forget the event. What is it? I don't remember what happened. That's the answer that we get. So one, whether loss of consciousness. Number two, whether he's forgotten the incidents, which is amnesia. Next is vomiting. Third is bleeding from either the nose, mouth or the ear. If that is there, we are very careful about that. And the last is if the person is complaining of a headache.
Hello, everyone. The Handlebar Conversation is about real people, real stories, and we talk with people who have been working on the ground and their experiences. Today, I'm honored to have a guest with me whom I have known for more than a decade now. And it's going to be completely different today because he holds a different experience, because we talk about riding, travel, motorcycling, safety. But what about what happens post crashes? So we've got Dr. Ravi Pratap, who is an emergency physician and a trauma physician, and he has around 18 years of experience taking care of people, making sure that they get back to life. Many a times we are not prepared for such situations, and we would get to learn a lot from his experience today. And this conversation is surely going to be something that's different than we have been doing till now. Ravi, welcome to the Handlebar Conversation.
Well, thank you so much, Kalyan. It's great to be here. It's a pleasure talking to you after so many years, probably. We met almost about a decade back, and since then we have been going to and fro with a lot of conversations. But today it's a different experience, and I'm glad our viewers would love it.
Yes. So Ravi, I know that you have a very busy schedule and you've got some time for us today. So I really want to thank you and from the viewers, because the information that they're going to get today is surely going to be different than what we generally put across on the platform. So Ravi, I just want the viewers to know, whoever is watching now, what does it mean to be an emergency physician or a trauma physician? Because everybody knows about doctors like cardiologists, or maybe a surgeon, a spine surgeon. But this is something that I'm sure even I didn't know a couple of years back till I met you.
Right. I think this question I've been trying to answer to people for the last 18 years now. It's a different specialty. Back in the days, there was nothing, no specialization as such where we could deal with emergencies. There was a concept of casualty where there used to be a room with a doctor sitting there. A patient comes in, he just used to understand, oh, he's having breathing difficulty, let me call this X doctor. He's got a fracture, let me call the ortho doctor. That was the sole purpose of that department to kind of channelize the patients to the right people. But then came the specialty of emergency and trauma, for that matter. We are trained to basically handle anything that you think is an emergency. We do not just move the patient away to the specialist. Our job is basically giving the primary treatment, where stabilization, converting the patient back to stable state, and then handing over it to the concerned specialty is our specialty in a nutshell. So giving an example, like if a patient comes to me with a fracture, I would like to give him the pain relief, get the x-ray done so that I understand what kind of a fracture it is, probably put in a slab to support the fracture, and then I know I'm not the surgeon who's going to operate on him. So then I call upon the ortho doctors, come have a look and take over the patient from me. So that's the primary job.
Oh, wonderful, wonderful. Because this was something that I also got to know after meeting you a couple of years back as to what exactly is done. So, Ravi, looking at the current situation, right? So, India has been growing so fast. We kind of scaling up when it comes to infrastructure. We're scaling up when it comes to all the technology that we have. But with that, we are also scaling up with the road accidents that we are seeing at the moment. And I'm sure that the number of accidents that we've seen, and that's during the COVID, right? So we had 138,000 people die on Indian roads. And I'm sure many of them could have been saved if they would have been kind of given the right care at the right time. So I'm sure that you see patients day in, day out. So right. I just want to know, it's like whenever these patients get to you, because no one knows what happens inside that emergency room. Whenever a patient gets in, there are a lot of things that happen. Right. So maybe if we can put that across to our audience and let them know what exactly happens when a patient gets in, and maybe any experience that you have that you can share.
Right. So, putting it in a nutshell, there are, trauma patients are going to increase because the number of vehicles on Indian roads are exponentially growing.
Yes.
And that leads to multiple chaotic situations where traumas are going to happen. And thanks to our government, which is progressive, of course, to build roads, which are, so in the Indian context, they are expressways, fast roads where we can drive at 120 kilometers an hour, given the example of many expressways for that matter.
Yeah.
So what happens is, in such situations, the trauma can happen. It's not completely in my hands. 50%, if I'm careful, I'm safe, but the rest of the 50% is always a chance. So accidents are accidents. They're never planned. So that's one thing that I would like to tell you. The other thing which I'll tell you is basically, why are we so concerned about trauma patients specifically? It's not a planned thing. Now, if I have a pneumonia and, I worsen over a period of time, I get cough, cold, fever to begin with. Then slowly the, infection might increase, which turns into a pneumonia. I begin with some amount of breathing difficulty and then the consequences. So probably it's a sequential thing which happens, but trauma is instant. Body doesn't get the time to cope up with the situation. It's a drastic change in the entire body's functionality. Now, why trauma causes so much of disruption? There are three reasons for death, or three divisions how a patient might be might get impacted with. The first is, it's a massive trauma where the injury itself was so bad that the patient dies on the scene. Is this preventable? Yes, up to a certain extent, depending upon the driving style and the safety precautions that we need to take. But from a medical point of view, these are the patients, or these are the victims, I would say, who we can't really do anything about. Like, there are traumas where the speed was so high that the injury has literally crushed the body. You can't do anything about it. The patient dies on the scene before any help could arrive. Then comes the second part, where actually the maximum number of deaths happen, and that is the sad part. This is where the patient has got a major injury, but because of lack of actual care, and care in the sense that everybody would want to help the patient. It's not that somebody would say, "Oh, I don't want to do it." I would say 90% of people would actually go ahead and try and help the person. But is it the apt help is one big question mark. If not helped properly, it's not of any help. It basically worsens the situation at many of the times. And this is where the maximum deaths happen. Now, I need not tell you the experience that you must have also had. Patient gets into a road traffic accident, he's bleeding, which can easily be stopped and saved. But because help arrives after 1 hour, 2 hour, 3 hours, whatever, this patient dies because of the bleeding. Now that itself is one of the biggest challenges that India is facing. Our trauma response has been improving, of course, over the years, but we are still a long way to go.
Yes.
And that is where the main issue is. And probably today, if we are talking on this is where I would want to emphasize that is where, as a citizen, not only as doctors, that is the primary area where we need to look into. And then comes the third one, which is much later. So if a patient has got a crush injury, which has been treated otherwise, but because of that, dearth of the injury, he gets into a complication, say an infection, or there could be any other things as well, without complicating it with jargons from my specialty. That patient gets into a complication and he dies after that because the body could not cope up. That is again beyond a normal citizen's scope. That comes under our purview, and that is something which is best kept for the physicians. But the middle part, where the maximum deaths happen, is something which people should understand. The other thing, I believe that most people know that in the West, they have a concept of levels of trauma centers. Level 3, level 2, level 1. Level 1 being the highest amount of specialty, and level 3 being the lowest one. So in that, what happens if you got a simple fracture of your wrist? You go to a level 3 probably, where there's an X-ray which can be done, it can be taken care of, an orthopedician sees and he treats you. But say a crash, like driving your car at 100 kilometers an hour and you crash with a lorry, where you've got multiple injuries including head, neck, chest, and in a state where aggressive treatment is required, that goes to a level 1, where the expertise lies. Unfortunately, in India, we are still to be there. There are trauma centers, giving one example, the JNPT, Jayaprakash Narayan Trauma Center in Delhi, which is AIMS. They do a phenomenal job. I've personally been there. That's a level 1 trauma center. But it's again very, very loculated. It's not a widespread concept. Hospitals do have trauma centers and they do have capacity to treat trauma, but not the way how the West treats. Not that they are better than us, but because we are such a big population and we are still kind of grabbing hold of the emergency and trauma response system, we are going to be there. But the other thing which we always see is the patient is taken to the nearest hospital. Now the problem here is whether that nearest hospital, which is just a 10-bed facility, do they actually have that expertise?
Exactly.
Most of the time the answer is no. So the chances of misdiagnosis and mistreatment, not voluntarily, but because the expertise doesn't lie there, that is where we face the challenge. So by the time the patient comes to a larger center where the expertise lies, many of the times we do lose the patients. That's how it is.
So that's a very good thing that you just mentioned, and even I was not aware about that, because I have on the roads many a times I have been taking patients to the closest hospital. So that's something that even I didn't know.
Right.
And there were cases where I've taken them to an orthopedic hospital just thinking that they would get the right help. So right. I'm sure people are going to get to know from this. So Ravi, is there a way that people should react? Because I know that whenever, I'm sure it's not easy for you also, because everybody is a human being, right? Mm-hmm. But is there a way that people should react when they see, because whenever we see someone bleeding or in a very bad state, sometimes I've seen people, they themselves want to help, but they themselves faint, or they themselves get into a situation where it's not likely. So is there something that you can recommend, or maybe with your experience, that people should take care? Because as you talked about someone bleeding and that can be stopped, I've seen people go with bare hands, right? So something from your right. side that could help people whenever they want to help, because everybody has that intent to go and do good, but not at the cost of your own life, right?
Very true. I think that's one of the, very important things that people should understand. As I said, I believe 90% of people on the roads would definitely want to help somebody if they can. There are two factors to it. The first thing is the lack of knowledge of what to do.
Yes.
Many of the times we do not do things because we do not know what to do. So that is one big thing. And we unfortunately do not have a, system where the common man is really treated with really taught how to treat patients, or the first aid for that matter. So we do get confused. Should I do this? Should I not? That is one confusion. The second thing is, which, saying it aloud, people are scared. Why? Legalities, police. So that is another big factor which keeps people away. The third thing is, in case if I do this, am I going to be dragged into it unnecessarily? Unfortunately, things do happen. We have seen cases where, unfortunately, the person who wanted to help was dragged into the case, saying that you are the one who's done this. Now, these are few factors which need to be looked into. I'm not the right person probably to, comment on this, but the authorities should look into it. Even though India does have this saying that if somebody has helped, say, Good Samaritan, who has actually helped a trauma victim, they're not supposed to be bothered by any of the authorities.
Yes.
But this knowledge is not kind of being percolated into the society, where people do not know. Other thing is bleeding. Now, we as doctors, we have gloves available, immediately we put on our protective equipment so that we are not affected. Because to be very honest, infection does spread with blood, starting from HIV, HPSAG, which is hepatitis B, hepatitis C, and many others. We do not know what the person has. It might not be that it is there, but jumping ahead to help somebody without realizing that it could be harm to you is also not something which is advisable. So we always say that, fine, if you're aware of what needs to be done, perfectly okay. But if you're not aware, avoid trying to do something which you're not supposed to do.
Yes.
I'll give you very simple examples. I'll tell you. Even if you just walk out and unfortunately somebody falls down from his two-wheeler, inadvertently, if you see people running and trying to pick up the bike first than the patient.
Yes.
And the next thing that happens is, they would jump in, grab hold of the fellow and try to make him sit up or stand up. I don't know why. Is that a human reaction over? That's the worst thing that can be done. And the next is feeding him or giving him water. Any person who is semi-conscious or conscious, if we try to feed or give a drink to that fellow, can cause way more worse complications than the trauma itself. So whenever a fellow falls down from a two-wheeler, or say he gets into a crash, initial few minutes could be because of days. He might be disoriented because of that sudden impact. And at that point of time, if we try to kind of do a lot of things to him, it is going to harm him more than actually helping. And bleeding. Now, where will a normal person get a gloves from? It is not practically possible that you carry a gloves in your pocket all the time. So what I always say, that if it is bleeding, the best way to stop bleeding is applying pressure. Now, how do you apply pressure there? Now, that is one thing which comes with training. For us, we are aware of it because we're trained in doing that. But for a common man, I would like to give this message that if you see a bleeding, the best is to apply pressure. Now, how do you protect yourself and apply pressure as well? So the best thing is, get a piece of cloth, anything, it could be anything, and put it on the wound. Probably just get a plastic bag, which is readily available, unfortunately, in India.
Yeah.
Put it onto your hands and just apply pressure. You do not do any fine movements which we need to do while wearing gloves. You need not do that. All you need to do is just apply the pressure. That itself kind of stop the bleeding to quiet a bit and probably give a fighting chance to the person who's bleeding. These are small things which, of course, just speaking might not be good enough for people to understand how they want to do it. But yes, if they wish to get trained, there are quite a few courses which they can undergo, and it helps basically.
Yes. And these are situations that, Ravi, I believe, don't knock at your door and get to you. These are situations that are always going to be unprecedented, and they're going to be a surprise for everybody. But many a times, being a biker, being on the road most of the times, I have seen these people crowd around the patient, and the patient tries to communicate something. They try to say something, or maybe they're trying to tell them that, okay, this is what is happening to me. But there's no one who's trying to give them a ear. And it's like everybody is trying to be the boss there, trying to help and make sure that they bring in something. But ultimately, in such situations, Ravi, because I know that the time once an incident happens, right, the clock is ticking and it's going anti-clockwise, right? The more delay, the more difficult it is to kind of revive a particular patient. So what is the challenge that you see for patients who get impacted and getting to the hospital? What are the challenges that you see? Because you would see patients coming in day out, which have different scenarios, different situations that they come in. So any experience that you
Yes, of
can
course.
share?
Yes. Few experiences are actually, funny in a way, where we have actually seen people fighting that I want to help this fellow, and the other fellow saying that I want to help this fellow. It has happened. No, I don't want him to go to that hospital because I don't like that hospital. Or the other fellow, no, I trust that hospital better, so please take him there. Now, this is where, again, as a community in India, I think we should start emphasizing on one thing, that we are still lacking on that awareness part. Where if you see, we need not go to the United States or to the UK. You watch their movies or their web series. One thing which comes like this to people: if they see an emergency, call 911. Not that I know much about that system, but at least that is common. Now, do we have something like that in common? We do have. But are we really aware that something like that is available?
Yes.
I would not take names and numbers here, because it might cause confusion, because multiple states have different numbers also. But there are certain numbers which are common. Are we aware of those numbers? The other problem that we face is, people say that if we call a private hospital, probably they might respond better. We will not call the government number because they might not respond as good. But I have been part of multiple government organizations as well, not primarily, but in trainings and discussing with the authorities there. Government backed organizations are also doing phenomenal as far as the primary response goes. And even if I might say that they are doing better than many of the private sectors as well. So our faith on that is something where the authorities need to step in, make us aware that this is the work that we do, and you have to trust us to treat you better. Now, one number we call, that ambulance responds within 15 minutes. It keeps happening on a repeated basis. The amount of trust that builds up over a period of time is excellent. But we have, practically, if you ask me, still to be there. So that is one thing. The other thing is, whenever there is a crash, I don't know why it is an Indian scenario where everybody wants to jump in and do something or the other. Is it a validation that you're looking for? Oh, I helped somebody? Or is it something that, oh, I know everything and I can do it? So that confusion is always there. So I believe the awareness is one big thing which need to be worked on. Not that the intent is wrong, but the ultimate result causes a lot of trouble.
Yes, because everybody wants to help, and I have seen people, and in the cities, I know everybody has a busy schedule and people don't stop by. But when we've been on tours, or maybe when we've been in smaller towns, I've seen people have been very helpful there.
True.
And everybody has the intent to save a life, and we don't know, right? Today I'm talking, but it might happen that sometime I might also meet up with an accident. So I have been promoting giving way to an ambulance, Ravi, and you talked about ambulance, so I would like to share that. But there has been a major gap in the awareness that people carry when it comes to ambulances, because they don't know what to do. They want to do something, but they don't know what to do. So moving to the left and stopping is what I educate people. But at times there are also ambulances which are going to pick up a patient, right? And they have the sirens on because it is still an emergency. And people don't realize that. So a lot of people, when I talk to them and I speak to them, they tell me there was no patient in the ambulance and he's got the siren. Just because there's traffic, he's put it on. We don't know. So it's going to be very difficult to kind of find the wrong ones out of those people that are there, right? So this is something that's very nice that you just touched. But Ravi, taking the conversation a bit ahead, right? Being bikers, and we all have been on the roads, there are a lot of bikers who actually go to trails where there is very less accessibility to medical care. So is there something that you can help them with, that they should be making sure that they carry, or maybe they make sure that they are aware about if they meet up with a crash? Because those are situations where they have to manage things by themselves.
Right. Right. No, this is something which I believe is one of the most important things. Like you are aware, you've been into biking for quite some time, is what I know.
Yes.
I was into one, but then I lost track of it. But what I personally feel that, before you go off-roading or before you go for a long trail, there are certain trainings, or rather, understanding that the group has. Okay, fine. There are signals that you do to, probably
Yes.
taking a turn or slow down or speed up or things like that. How bikers communicate with each other.
Yeah.
Now, that doesn't come in one day. That is something which you have probably trained and re-spoken about those things.
Yes.
Like a tire gets punctured. You probably carry a kit which
Yes.
is going to repair that, because there's no help is going to arrive there.
Yes.
Now, these are small things which biker communities have actually come up with, which is actually helpful during a crisis situation, for that matter. Unfortunately, probably I have not come across any organization or any biking community which actually focuses on the medical emergency. Now, given today's era, people are getting heart attacks even in their 20s. Now, fine. Obviously, a biker cannot be expected to treat a heart attack. But at least if he's aware that, okay, these are signs and symptoms, probably this is what needs to be done if something like this happens, that can itself prevent a lot of things. Unfortunately, I'll share an thing with you. One of my colleagues, he himself is a doctor, and he was a trainer for CPR. He was a certified trainer for CPR, where he probably knows way better than many people how to treat a patient in cardiac arrest.
Mm-hmm.
He was an avid, mountaineer, and he used to go for treks almost every month. Very active fellow, very fit fellow. He had some kind of a discomfort before he went for the trek, but because he was so motivated to go for the trek, he didn't pay any heed. Unfortunately, he had a cardiac arrest during the trail, accompanied by 5-6 doctors who were also with him during the trail. He could not be saved. So the thing is, if a doctor can miss those signs and symptoms, there's something wrong with me, a common man can easily see.
Yes.
And this only comes as an awareness that, don't take chances. That is one big thing which I always tell my patients: don't take chances. Even if you feel that, I am going to just waste 1,000 rupees for getting a doctor's checkup and an ECG, please do that. That is one. Number two, for trauma, unless and until you're aware how to do what needs to be done, you cannot treat the patient there. The outcome is going to be very, very different than what it would have. Like, military, when they go for a war or when they go for an expedition, there are not doctors available everywhere, but each one of them are trained to provide excellent first aid. Can we not do that for all our bikers, specifically
Yes.
as a community? If they come up with a thing, and if they are in connect with somebody who's ready to help them out with that kind of a training, that is always going to be helpful. You need not carry much. Medications is something which I would never say, except for a small painkiller, is what they can carry. But the rest of the few equipments which needs to be carried is basically a splint, maybe, where in case of a fracture happens, they can kind of put a splint and take it from there. So these are small things which can be done. So one appeal to the bikers community: please get yourself trained. That's very important.
Yes, Ravi, and I'm sure the bikers who are watching this would surely resonate, and this is also something that I would personally start taking up after this conversation that we're having, to make sure that I spread this across with the community, because the challenge in India that I've seen, Ravi, with the programs that I do, I have noticed that people have an insurance for their vehicle that they're driving, but they don't have a medical insurance for themselves, where if there's a need for an hospitalization, they don't have that. And,
Exactly.
And we always look upon things saying, okay, this is something that is not a good thought to look into, like something bad is going to happen in the future. So we avoid it. So I've been appealing people and telling
So
them.
just adding up to that, this is again a human mentality that मेरे साथ नहीं होगा.
Yes.
मुझे problem नहीं होगी. But it's never going to be so. See, everybody is going to die.
Yeah.
Today, tomorrow, maybe in a couple of years, we do not know. But we are sure that we are going to die. Let's be honest about it, that fine, कल मैं भी गिर सकता हूँ. Even though I am a very, very, experienced and skilled rider, a small boulder out of the blue can easily take me off the road. Now, what if that happens? That preparedness for the unexpected is something which makes the difference between life and death here. So, given the roads today, Really, unless and until the government is that strict that you cannot take your bike without a helmet, you know, people still do not. अरे मैं इधर बाजू को ही गया था.
Yes.
I didn't go very far. It doesn't matter. Even if you skid and fall outside your house, you might have a bad head injury. So these are few things which, as a human being, we should understand.
Ravi, I was just going to come to this, and good that you touched this. So, head injuries, right? When we hear about head injuries, and I've been promoting helmets, so when I talk to people, there are a lot of questions that people have when it comes to head injury. So, how dangerous it is to have a head injury, and what could be the repercussions of having a head injury, and how difficult is it for a trauma physician like you when you see a head injury patient come in front of you? How difficult is it?
Right. So, head, as we say, is a head for a reason, right? It's something which controls the entire body's functioning. And if that is cut out, probably the entire body functions and it's of no use. So you've heard about patients being brain dead in, vegetative state. And head injury is one of the most common and, most important reasons which leads a person to being brain dead. Now, not one, but it's almost a daily affair for us where we see patients coming in after a two-wheeler accident, not a single scratch on their body, probably just a little bit of abrasion here and there, but with a massive head injury. The reason behind that is whenever we fall, neck being the most mobile, part of our spine, holding the weight of the head is not that simple when you fall, because your body is more focused towards preventing a fall with your hands outstretched, but not the head really. And we can't really control it, believe me. And when a head is hit, because it's a closed compartment, the brain gets a jolt and bleeding and other injuries can happen without even we realizing that it has happened. And many of the times you might be absolutely normal in appearance when you land up in the hospital for a checkup. But unless and until we actually do an imaging, depending upon what kind of trauma it was, it's very difficult for us to really say that this patient is good or not. So even if a doctor is advising a CT scan for the brain without you actually feeling anything, please go ahead with it, because we have seen patients getting the symptoms after a day's time also. So it's one of the important things. And head injury, the other problem, what I have seen is if it is a major head injury, even if you are alive after that, your quality of life goes for the toss. There are young patients who are 19 years, 20 years, just picked up their two-wheelers and started riding. Probably they did not put on a helmet or nobody insisted on them putting on a helmet. They get into a crash, they hit their head, the brain injury occurs, neurosurgeon intervenes, he operates, saves his life. But believe me, there are patients who are on bed for life. A 19-year-old boy with probably parents in their late 40s 50, or early 50s, for the rest of their lives, he is no more an asset. He becomes a liability. And this is where people do not realize the amount of emotional burden, forgetting the financial part of it as the treatment and the hassle that they go through. The emotional burden that the parents have to carry is something which people should really think through. Now, that is a young fellow. Say a fellow who's in his mid-30s with a young child and a wife. Parents are elderly. Everybody is looking up to him. And I'm taking the name of males because males are more prone towards getting road traffic accidents because they are more in numbers as far as two-wheelers go. So this fellow gets into a road traffic accident, again, a major head injury. He's probably paralyzed halfway, not able to speak, not able to remember things probably. So technically he's led to become a person who is no more a asset for the family, but a liability. Now, where does the burden go? It goes to the family.
Yes.
A young child who probably requires the support most at that point of time doesn't get it. The wife is under due stress because of this. And if he's the only earning member at that point of time, you can imagine the, complexities around it. So these are very important points which people should understand. And unfortunately, we are privy to this. We see the primary as well, where the patient has gotten into the trauma and come. And after that, once he is discharged after 15, 20, 30 days, whatever time he's in the hospital, they keep coming back to the hospital in that vegetative kind of a state where they are not able to do anything. Even going to the washroom is not something which is possible for them. They keep coming back to the hospital with some or the other complications. Now, is that something which I would want for myself? Definitely not.
Yes.
And given the scenario in India, it is not easy. The financial burden that it carries with it, the social burden that it carries with it is not easy. So people should be aware that a helmet might not protect you 100%, but it will definitely give a protection of 85 to 90%.
Yes.
It's as simple as that.
Yes. No, Ravi, you kind of touched it very well, and it's been something that I've been working very closely, and I can totally resonate to what you say, because the number of people that meet up with an head injury, and many times what happens is like people have met with an injury, right? Even after wearing a helmet, as you said, it doesn't really protect, because it's just an additional layer of protection that we had. Just like the screen guards that we have on the phone, and that's the example that I give during my programs.
Right.
I tell people that's just protecting your screen. So it doesn't guarantee that your screen will not take that impact. There's going to be a minimal impact that's going to get to your screen over the time, right? If you keep dropping it.
True.
So with the helmets, people putting it on and they meet up with a crash, I'm sure most of them just stand up and walk and get back to their daily life. But I'm sure that it's taken some or the other impact, right? Though it's not showing up right now. But are there chances that over the years, there could be chances that it could show up? And do people need to give it a thought whenever they have a crash and they feel, okay, no, this was a crash that's serious enough, but I'm fine now. I don't have any challenges.
Right.
But should they go and at least get some basic tests done?
Yes, they should. The point here is, when a patient comes to me with a crash, there are a few questions that we ask to understand whether there's a head injury or not. First, did they lose consciousness at the site? We keep on insisting who has seen you first, because this person might not remember. That is called amnesia. Basically, they forget the event. I don't remember what happened. That's the answer that we get. So one, whether loss of consciousness. Number two, whether he's forgotten the incidents, which is amnesia. Next is vomiting. Third is bleeding from either the nose, mouth, or the ear. If that is there, we are very careful about that. And the last is if the person is complaining of a headache. Now, these are the 5 signs and symptoms that we always ask the patient that if you have these, then we always get a CT scan done. If not, it's again a clinical judgment for us. Not that every patient has to undergo a CT scan, absolutely not.
Yes.
But then that's a clinical judgment that let the doctor take it.
Yes.
That's what I would say. Don't guess that, okay, I need it or I don't. If you have any of these symptoms after a crash, please make sure that you get a checkup done.
Yeah.
And other thing is, if you're at the extremes of your age, if somebody who's below 10 years of age or somebody who's above the age of 60, irrespective of whatever type of trauma it is, we always insist on getting the CT scan done. There are 2 reasons behind that. Children are not somebody who will be able to express themselves the way an adult would. So they might not really tell you that there's a problem, but it is still there. So it's better that the doctor assesses and does the thing. And again, in elderlies, what happens, because with age, the brain shrinks. Skull remains the same. So there's some amount of potential space that happens between the brain and the skull. Imagine a ball inside another ball. So in case of even a small injury, there could be a slight bit of bleeding. And because there is space for that bleeding to increase over a period of time, we have seen patients who had a trivial fall at home, hit their head a little bit, nothing, there was just a bump, he didn't do anything. After 15, 20, 30 days, they'll end up in the emergency department with sudden loss of consciousness. Then when we do the CT scan, we realize that there's a massive bleeding which has happened over a period of 15, 20 days. So it's again a clinical judgment. But yes, as I said, the 5 things which I'll repeat. One is loss of consciousness. Second is forgotten what has happened. Third is headache, vomiting, and bleeding from the nose or the ear. That's the thing.
I believe this will really be helpful. And one thing that you mentioned, I feel that's very important for today's age when AI is taking over. Everybody is relying on the AI prompts. They put up a prompt and it gives you every single thing that they feel is true. But as you said, they need to rely on a doctor's decision, right? And that's very important.
So I'll just put this as from a biker's or a motorist's point of view. Like if I'm not a motorist or I'm not a avid biker for that matter, if I say what are the skills that I require to be a good motorist, it'll give me n number of things. But am I really the person who can actually understand that and apply it?
Yes.
So it applies to every specialty. Yes. So yes, AI is helpful. I'll not say against AI. AI has been really helpful for many things, but we also should understand where to pick up what. And unless until you're an expert in that field, it's better left to the experts at this moment. Maybe 15, 20 years later, it might be a different story. At present, human beings are yet to be replaced.
Yes. So, Ravi, we talked about these head injuries, right? So many a times on the roads when people have a crash, and it's not bikers, but it's any common citizen who's is traveling basically, and there are a lot of people who are trying to save and they're trying to pick up, and you did talk about that. Don't pick them up. So, are there symptoms or signs that people can look for, where, or maybe something that they can see and say, okay, we should not pick this patient because there could be a spine injury or a head injury?
Absolutely. I completely agree with this point that, people should also realize where to move. There's one thing which is called scene safety. Now, if an accident has happened in the middle of the road, you cannot just leave the fellow there. He needs to be shifted to the side of the road, which is the right thing to do. But the problem here is how to shift them. If a person is unconscious, be extremely careful before moving him. So why? Because an unconscious person, he's not able to tell you if there's a pain anywhere. So you might end up, creating more trouble for that fellow by increasing the injury by just trying to move him. What I have seen many of the times, I've seen, unfortunately, I could not have intervened at every place. They just pick up the fellow from wherever they can get hold of him and, kind of lift them up and take them to the side of the road, which is the right thing to do, but not the right way to do. So what happens if you pick up somebody who's kind of flat? What will happen is his head will kind of go back like this. It will fall back. And that is where the problem with, if he's got a cervical spine injury, which is very common along with head injury, he might land up in a paralyzed state forever in his life. So be careful whenever we move a patient. It is always prudent that we support the head from below so that, the spine and the head are in the same, level without any twisting and turning. Easier said than done because training is required for that. But at least people should be aware that the head should also be supported before moving. And never try to make that fellow sit up and give water. That's the worst thing that anybody can do.
And I have also seen people giving him cold drinks and not just water, because those aerated drinks, right? And I believe that's something that is purely towards awareness, and people need to be more aware about these things. So, Ravi, as we are talking about these injuries and the trauma that people go through, right? There might be some story that you must have seen, which our viewers could learn from. If there's something that you have on your mind and you would like to share.
Right. So, giving in the example of the recent Supreme Court judgment where euthanasia was allowed, probably, so vividly in the Indian scenario, which is not a case otherwise, which has been a monumental judgment from the Supreme Court of India. Young fellow, he was an engineering student. I think the entire country is aware of this. He had a fall from his hostel and he probably injured his head. I'm not aware of the details of all the things, but he had been in a vegetative state for almost 12 years. Parents were getting elderly. It was a challenge for them on a day-to-day basis to manage him. So again, as I said earlier as well, the emotional trauma that they've gone is unbelievable. And what happens in such situation, there's one thing we say, caregiver fatigue. After a certain while, even if you love the person more than yourself, you will get fatigued. Your brain will stop functioning in a way that you can push yourself any further. Now, this is where they had appealed to the courts that please allow us for euthanasia. That is basically letting the person die without an active act of that. So Supreme Court allowed it, understanding the situation, and he basically passed away in All India Institute of Medical Sciences under medical supervision, of course. Now that is why am I taking an example of this is, imagine parents, is it giving up on the child? No, it is basically he let him go. The amount of the amount of trauma that they have gone through, seeing the child suffer like that is something which is unparalleled. So there are many cases like this which we see where there was a car accident in which the husband wife was sitting ahead and the child was behind. And another thing, coming to this story, we do not use child seat.
Yes.
We do not use seat belts in the back seat. Worst thing that can
That's
happen.
a sad state of
That's
India.
the sad state. And this has happened. Husband, wife, both were injured, but were alive. Child died. So, and we are aware of that. They kept on asking, how's my child? Where is my child? And we had no answer to that, because we know the child has died and we didn't want to kind of tell them right away that, the child is no more. Imagine, it's basically putting yourself in that place. It's not something which you would want to undergo. And I appeal to everyone, even people who are, very well educated. I rarely see them wearing a seatbelt. And then another thing is the difference where you are traveling to. Fine, if you are probably going for a 500-meter drive in the city at a speed of 30 kilometers an hour, probably, I would not justify it, but maybe it's okay for that point of time. But if you're on the highway, if it is on the highway, the speeds are very different. One trauma and the entire thing changes. So precautions, there is no two way to it. You have to use it. If these precautionary things have been made mandatory in the cars by the government, there's a reason behind that. They've just not made it mandatory out of the blue. I am aware. I believe people are aware that 2 airbags are now mandatory for every car in India. Why? There has to be a reason. So people should understand the importance of it and start using it.
Yeah, that's really true, because road safety is the least looked upon thing when it comes to India, and people have that let go attitude, saying, okay, nothing is going to happen to me because I have a lot of skill when it comes to driving, because I've been driving for these many years. I own a driving license, and people feel owning a driving license is a certificate that's issued to you saying, okay, you are a very good driver. But ultimately, that just gives you the clearance to get onto the road and drive.
True.
So, Ravi, you talked about this, and this story, just hearing what you were saying, for a minute, I was taken back and was thinking, and it was at the back of my mind. So you see this day in, day out, right? And I'm sure it's not a very pleasant scene to see. And even you're a human being, though they say like doctors have been seeing this, and we do see this in the movies and stuff, right? They say over the time when you keep seeing it, you just have a solid heart, and you really don't have those emotions and stuff. But I'm sure you're also a human being and you see this. Do you have days that you've got back home and you've felt like this is something that's very sad, it shouldn't have happened?
No, it's actually something which people do not realize, that doctors are humans by the end of the day. Yes, we, over a period of time, we learn how to compartmentalize ourselves. Okay, fine, this is over, now I'm going home, I'll compartmentalize that. I don't want to carry it home. But is it possible all the time? The answer is no, because many of the times it does happen that I'm disturbed through the day, through the week, because I'm not able to come out of that. Because most of the times these injuries, these deaths are technically preventable. If that one small effort of managing it in a different way from the person himself who was the victim could have really changed the way. The one example, as I just said about the child, it was so difficult because, I have children, most people have their children. When it comes to children specifically, it's even more difficult. Recently, about last week, I would say, a young boy was brought in after a two-wheeler accident. There were two two-wheelers which collided. This fellow had an injury to the left side of the face, and no other injuries in the entire body. Brought in an unconscious state. We managed him. We intubated, put him on a ventilator, did everything. When we saw the CT scan, the heart sank. 17-year-old boy. And seeing the CT scan, obviously with so many years of experience, we know what the outcome is going to be. And even if we thought that if he makes through the next 24, 48 hours, he's not going to have a quality of life. He's technically going to be so disabled because of the injury, but his life is practically over. So these things do affect us, as they say, heart of stone or whatever. It's not really so. We do get affected really badly at point of time where, we also, burn out because of all these thoughts. But then again, we kind of bounce back again and, start doing our work over and over again. That's out there.
And you guys I would say that you guys are the ones who give people rebirth, like the mother gives birth to a child. You guys bring back people to their life, and I'm sure that the amount of work that you all put in, the amount of work that you all do for the society, as citizens, we don't thank, and it's a thankless job, is what I feel. Because, and I'm sure in your experience, you would have come across this.
Yeah, it does happen. It's again about perspective. For emergency physicians, we will never be the terminal specialty. We are always at the forefront managing the emergencies. Beyond that, we generally do not do much. We always hand it over to the concerned specialists, and it does happen. We do. When I was a younger self, we were used to get very frustrated. "Arey, I did the hard work, and why is that other doctor getting all the glory?" But then with maturity and with age, with experience, you do realize that it doesn't really matter. I'll give you an example. A man in his mid 50s came to the emergency department with a chest pain. Now, he was literally dragged by his family to the, to the hospital. Ki, "Nahi, nahi, there's something wrong. You should come." He was not ready to come to the hospital. And after coming to the hospital, he was not ready to even let us do anything. We did an ECG, and the first ECG came out to be normal, bang normal. So what happens? ECG normal, matlab sab sahi. That's what the misconception is. But then we insisted that please wait, we'll do a blood test, we'll understand. Blood test was running. It takes about 15 minutes of time for that report to come, and before we could do anything, he just collapsed. Right. So his heart technically went into a cardiac arrest. It took us 40 minutes to revive him. We gave him some not less than 20 shocks to revive his heart. Lucky enough, after 40 minutes, which is generally a tremendous amount of efforts that the entire team took, we managed to recover him. And after that, we did the ECG again. Turned out to be a massive heart attack. The cardiology team immediately intervened, took him to the cath lab, got in an angioplasty done. So the crisis was over. After 4 days, the fellow was discharged. But he and his family made sure that they wait for me for 4 hours before I get into the hospital. They waited for me. They met me. The patient himself, he literally hugged me that you saved my life. And that's about it. And he walked off. Now, did I get, a prize for it? No, that's my job. It's something which I have to do. But that feedback from that patient, that thank you so much, he's probably 1 out of 500 who actually took that effort to come back to the primary doctor to tell him that what help I have done. And that is more than enough for us to keep going for the next 1 year, 2 years. So there's another fellow who might come back after a year's time and say, "Thank you, doctor." So that's how.
And I'm sure, Ravi, this is something that is more than an award, because I'm sure the happiness that you must have got saving his life is something that's not measurable for us. But I have an appeal to everybody who's watching. The next time you happen to be to a doctor or any of the physicians, make sure that you thank them for the job that they're doing, because that's the best that we can do to them, because they're the ones who are saving lives every day in, day out. So that's the least that we can do for them.
Thank you so much for that, Nilyan. It's something which, I would say that it's a phenomenal gesture that you just given. See, for physicians who work in this, high tension environment all the time, 90% of the things are beyond their control. But whatever 10% is there, every doctor tries to give their best.
Yes.
It's absolutely okay if you do not appreciate somebody, but acknowledging does help us a lot. That's that.
And you being on the first line of this entire crisis, right? Because you're the one who's going to first take care of the patient. You, your team, anybody who's a trauma physician or an emergency physician, that's something that people should know. And the reason that I believe we look at doctors or we look at that particular profession, it's a very respectful profession, because I do remember from my childhood, right, when I used to go to my general physician. So my grandmom or my parents used to say that you need to thank them or maybe be respectful. And that's something that's always been there. So I am sure that we should start doing that towards, because we've seen you guys be the saviors during the biggest pandemic that we've witnessed. That's the COVID that came in, right? And you guys have done a phenomenal job in saving a lot of lives.
I do agree with you. There are two sides to it. See, there would be black sheeps in every profession. That does not really generalize the entire profession. I know it's a very, very debatable topic. Let's not get there.
Yes.
But if somebody who you do not know, you have gone out to that doctor and he has treated you for whatever, even if it's a very small thing, giving you a paracetamol tablet, and that applies not only to doctors. If you're getting down from an auto rickshaw, you pay him. That's his job, that he got you from point A to point B, and you're paying him for that. But if you just say a simple thank you, Bhaiya, he will feel a little good, right?
Yes.
This is something which, as human beings, we should be respectful towards each other. If I get down from a rickshaw and I say just pay him and walk off, it's not going to harm anyone, but it's not going to give that cordial relationship between me and you. There's delivery guys coming to your home to deliver something. You just grab it and walk off. You just say a simple thank you so much. That's all that is required. So it's not for doctors per se. We are doing our job. Everybody else is doing their job. Whoever is doing their job well, please say thank you to them. Not to the doctors per se, but whoever it is.
Yes.
Like say if Kalyan is offering me a glass of water and I just take the glass and have the water, perfectly okay. But if I say thanks Kalyan for the water, he'll feel good.
Yes.
That's
true. And that's really nice of you, Ravi, in fact. And Ravi, I know that we've been talking about all this, the trauma and how we can save, but there's one thing that I always had on my mind. Is like many times people, and that's what I see when it comes to long distance travel, right? People feel, okay, now I have had good amount of sleep. I feel fresh in the morning. But when they are on the roads, after a few 100 kilometers, right, fatigue starts hitting them. And what they start doing is they first start having coffee, then they would slowly increase the amount of coffee that they take in. And then they, over the time, would ultimately start getting into those energy drinks that we have. So how dangerous is it if I have something like that? Because I know that it has a lot of caffeine in it, right? The energy drinks have a lot of caffeine. So if after that, if I meet up with an accident, how difficult is it for you to get the patient into good
I
sleep?
understand what you're wanting to understand. See, the first thing before we go into the caffeine part, I would like to say that, even I drive long distances. I love driving and I've driven across India in my car. What I hear people boasting, I went from this city to that city in this much amount of time. So what? Is it something that is going to, reward you something? Driving does not mean driving fast. It's driving responsibly. If you know your limits, and it's good to know your limits. Sometimes we think, 700 kilometers I can easily manage in a day. But it not be the same day as the previous one. Take it easy. Going from point A to point, they say, manzil apni jagah pe hai.
Correct.
Safar ka bhi maza lo. You need not, prove it to anybody that you can drive that fast. So it is always said, newer cars, the higher end cars are coming with fatigue detection, where they realize, by your driving style, by your movements and your, gesture on the face, they can detect that you're tired and they give prompts that take a break. So it's as simple as that. Take a break, have a cup of coffee. It's not a problem at all, but wait for another 15-20 minutes. Just relax your body a little bit, then again restart. It's nobody's going to award you for not stopping for 700 kilometers. It's just pushing yourself beyond your actual capacity. As and when fatigue builds up, you're aware, the airline industry is one that is so strict about pilot fatigue. And most of, if you have watched those documentaries about plane crashes, many of them have been attributed to, pilot fatigue. So your judgment clouds after a certain while. And caffeine does help for a short period of time, but it does add on to the stress to the body. So you're already stressed, you're having caffeine, you feel better for a while, but caffeine does increases your sympathetic activity, which basically increases your heart rate, blood pressure and everything. In a long term, that definitely is harmful. See, I'm not a expert in this field as far as caffeine and the caffeinated drinks that we have, so-called the energy drinks. They do help for a little while, but these are supposed to be used in moderation. You cannot have a pack of things over a period of 4 hours that you have drank 10 bottles of energy drink. It definitely is not going to solve any purpose. Rather, it might cause trouble for the patient.
Good. Ravi, thank you for sparing your time today and being here on the conversation. I'm sure that the viewers who are watching this would get to learn a lot, and they know what they need to do next time whenever they see a trauma. And this has been a great conversation. Thank you for bringing up time from your busy schedule. I know you have a very busy schedule, but thanks for pulling up time here.
It is entirely my pleasure. It's an excellent platform that you have created, and I'm glad to be here. And I'm happy that I could share a few experiences of mine. Hopefully, people should understand, even though it's not a very large conversation, but whatever small points that I said, if you're able to incorporate those in your day-to-day life, I think that's going to be helpful for everybody. So thank you so much, Kalyan, for having me here. It's been a pleasure.
So guys, I'm sure you must have heard the conversation now, and this conversation is something that's very close because I have seen a lot of people lose their lives on Indian roads, and that's the reason I thought I should have this conversation. And today we've been honored to have Dr. Ravi Pratap here with us, who is an emergency and trauma physician. So as we do send out a message through every episode that we talk on, so this episode being special, I would want doctor to share a message for the society, which would be really helpful.
Well, my message to the society would be, don't take pride in taking shortcuts. Train your children from the day they are born to follow the rules and not take chances with themselves. We are human beings and our lives are important. And if we do not respect our lives ourselves, nobody else would. So putting on a helmet, putting on the seat belt, starting to use child seats for smaller children is something which is very, very prudent for us. And I strongly urge the entire society in India to adopt to it, and don't wait for the government to make it mandatory. Do it yourself. It's your life. It's not the government's. Please take this step, and I think things would fall into place gradually.
Thank you so much. So I hope you all enjoyed watching this entire conversation that we had today. If you have anything that you would like to share, put that in the comments. And Ravi has mentioned that he would be happy to help the biking community when it comes to trauma. So if at all we need to bring him on and have a session, he'll be more than happy. So if you require a session, make sure you put it up in the comments and we'll make sure that we get that arranged for you. Thank you for watching and see you on the next one.